Okay, hi guys. So I realized like 30 seconds ago that if I just labeled these videos how not to be a YouTuber, I would probably get millions more views because these videos are atrocious and I'm so sorry. I'm just not very good at this, but a couple of you guys have been asking me to keep explaining my journey as a dental hygienist now and relate back to things that I have learned from hygiene school. So I'm going to do my best to keep up with this and keep making videos for you guys because I know some of you do appreciate it and I appreciate that you guys appreciate it. So at first I was like, I don't really think that I can help them. Like, I don't think anything else I have to say people would care about from my point after graduating hygiene school. But then I realized today I was driving to work and I passed where I went to school and I was like thinking, my view on the word dental hygiene has changed so much in the past couple months and how different, like you think dental hygiene school, and now I think dental hygiene, I think going to work and how different things are from school. And I was like, oh my God, that's a great topic. And looking back, I was doing things already to help my transition into the real world without thinking about it. So maybe me telling my way of transitioning will help you guys kind of think about it too, because you don't hear, or we never really talked about the reality of the real world or what changes or things that aren't the same. And basically nothing is the same from school. School is very ideal. You do everything in a very ideal, perfect world scenario, and that's just not really how it is in the real world. So thinking back, honestly, personally, I went a little bit above because I shadowed in an office just to do required hours in a shadowing. And I had observed like, holy cow, like this is so different than what we do in school. And I was like nervous towards the end of it. I was like no one's talking about like what real world is going to be and like how we're going to transition into that. So I actually went and took it in my own hands and I was like, I'm going to keep shadowing in this office. I just went in, I observed like mornings or afternoons or something and just watched and just repeatedly watching a hygienist work and like how she talks to the patients, the times, how the doctors interact with the patients. None of that we really got to experience in school. So if you have the possibility or you have an office that you used to assist in or the office where you are a patient at, I highly suggest going and just observing extra voluntarily, talking to doctors, talking to the hygienist, the front desk, anything, just to get a little bit more experience, because it's such a great opportunity to kind of gather thoughts in your head. And I'm so glad I did it now, because looking back, like I think if I hadn't done that and seen a little bit of the reality and how things were going to differ, that I would have been completely overloaded brain-wise like my first week of work. So that kind of helped in a way because you get to see the difference and you get to see, I think I saw more patients my first week of school or my first week of work than I ever saw in school. Like that is just the reality of it. And it's super important that you don't feel overwhelmed that first week because it is a lot. And yeah, so I think observing. So if you have the opportunity to observe a little bit. The other thing that I kind of caught on to was you're going to be a unexperienced hygienist when you first get out into the real world, and that is super overwhelming, intimidating. We're gonna say intimidating because literally everybody's going to tell you, well, you don't have 3 hours to clean teeth anymore, and it will get so annoying because you're like, at first I was like, yeah, you know what, you're right, okay, I get 3 hours to clean teeth in school, and I almost accepted that until like the last like week or two of actual hygiene school clinic. And I was like, okay, how can I make this better? Because I'm sick of hearing it and I'm nervous. I'm like, you're right, I get 3 hours to clean teeth. I'm nervous because I'm gonna have 40 to an hour to clean teeth. So I was like, instead of mocking it, because you went through it too, you know, you had 3 hours to clean teeth at one point, how can I remedy this to make it feel better? So essentially towards your last semester, you're going to have about 3 hours of clinic, and it's required. You're going to have it. And I was thinking, I was like, you know what? That first hour of clinic, you're doing your packet. You are going through probing, you're going through your intraoral exams, you are writing, you are charting, you are taking, that whole packet itself takes an hour, okay? So I'm not good at math. I went to hygiene school. I only have to count to 32. I don't need any more math than counting to 32. Golden, okay? But I know 3 hours, okay? So you take an hour away from that, and that is your packet. So you're pretty much in hygiene school, you're waiting, you're doing your packet, and then you're waiting for probably at least 10 minutes to a half hour just to wait for that professor or instructor to come help you check in. If you have to wait less than that, that's awesome. If not, you know the reality of it. It's busy. You can't have a clinic instructor for every student, so that's just the reality of it. You do the packet, which I think we had, if I remember correctly, I think we had like 40 to 50 minutes even towards the last. So we'll just say an hour, and we'll say a half hour for waiting, and then it takes about 20 minutes to check in. So essentially you're already an hour and a half into that appointment. So like essentially it's not that bad. And then you have to review it with your instructor. Okay, that takes time. Let's say 10 to 20 minutes. So that's basically 2 hours of your clinical time is just waiting, doing your packet, going over stuff, oral self-care, not a big deal. So then I was like, okay, that leaves me like an hour and a couple minutes to do the cleaning, and you also have to check out, which takes about, I don't know, 10, 15 minutes. Waiting time was never really that bad because you're not going through the packet and stuff. So essentially you are basically trained to clean teeth in hygiene school within an hour 15 to 40 minute range. Like I have noticed that I don't feel, so I'm very fortunate and I get an hour right now per patient at the practice that I work at. And I mean, granted, some days you run behind and things definitely get off track, and you definitely will still run behind some days, and it will still be crazy. I'm not saying that an hour is way too much time. I'm just saying that an hour is a very ideal time. So essentially I have not felt in a way that I was unprepared in hygiene school because of how much time they give you. So you will probably still hear a lot, I'm sure, because like I said, you're unexperienced hygienists, and people like to always say, well, you don't have 3 hours. So take that into consideration when people say that, because transitioning is not that bad. So that was the other thing. Other than like just in general, things are different. You're not going to do every single thing for every single patient. You just don't have the time to do all of that. You kind of do oral self-care while you are cleaning the patient as you go. On my operatory light, I actually have a mirror. So I'll flip down the mirror. If I need to show the patient something, I'll just flip down the mirror, talk about it quick, go back to cleaning. I'll review brushing, flossing just as I go. I'm like, oh, there's like buildup, like you need, yeah. So basically, I don't think transitioning is that bad. It was super scary at first, and in school you had 2 hours to take an FMX, and now in the real world you basically have like 7 to 10 minutes to take one. And at first I was scatterbrained. I was like trying to flip my rings, and I was like, oh my god, like I hate FMXs. I used to dread seeing them in my schedule. But then after like the second or third FMX you truly take in practice, you're like, okay, this is easy. I know exactly how this goes. I remember everything. So honestly, x-rays aren't bad, and I felt like bite wings, they pretty much prepare you on in school because you take bite wings on a lot of your patients anyway. So basically I don't think transitioning was that horrible. if you have any specific questions on like what your school does versus what they do in the real world, you can shoot me a message or a comment below and I can try to kind of help you. I mean, I've only been an actual hygienist since I graduated, so it hasn't been that long, but I can try to help you as much as you can. If not, ask your local hygienist or an instructor or somebody close that you know out there, and just ask them if you have any concerning questions on transitioning. I'll make another video about getting your first job and stuff like that, which I'll kind of talk more in depth about working for an awesome practice, because having a good first job really does, I think, make a difference and help set the mood for your hygiene career. So I will make another video for that for you guys. I'm trying to think about like what else is like totally different. That's like, I don't know, I just feel like everything truly does come together and it's so worth it. When you're sitting there and no one is breathing down your neck, you're not like, oh my god, like I truly feel like in hygiene school, like you don't have confidence, you are nervous. And I'm just saying this for myself. I'm sure some people were very confident in hygiene school. Like I've said in all my other videos, I have to work for basically everything. I kind of have like a low confidence and stuff until I get to that point, and then I'm like, okay, like I did it and this is what I'm doing and this is how I'm gonna get better, and I do it. And I can truly say since graduating hygiene school that my confidence in dental hygiene has become so much greater than it ever has. And I feel like your patients thrive more when you enjoy your work and you talk to them and you feel confident. In hygiene school, you're like, oh my god, can I please like check one more time? Let me take this x-ray, like like you're nervous, and patients sense that and they understand because you're in school. But once you get out into the real world, they're not like, I mean, they're still gonna say, oh my gosh, you look 12, like how long have you been doing this? And you're like, well, I graduated in May. But honestly, they don't know how long you've been doing it. So if you have that confidence in yourself, they will be happy and they won't feel intimidated. Like kind of in hygiene school, I felt intimidated, so they probably felt a little like, oh, this is school. So I feel like having confidence and trusting yourself and things like that really does help. And I'm just going to touch really quick on like a weird thing that I've noticed transitioning is that you don't have, at least in our practice, we don't have posterior explorers in our instruments that we use. I mean, they are available to us, but I feel like that's a huge thing because in school you're constantly using that explorer to check areas. And then I know myself, like if I have a patient that has like buildup and I'm like noticing it under the gum line and like, or they haven't had a cleaning in a while or something, I will still pull one of their explorers just because it'll make me feel more confident that I got it all. Where like other people, I have definitely increased my tactile sensitivity where I'm feeling it with a scalar more, and I'm feeling it with my Barnhart and things like that. Like I'm confident that I'm not like missing things. So, which I felt like in hygiene school, you constantly relying on that posterior explorer all the time. And so that's kind of a weird transition that I noticed. Like I'm like, wow, and I say that all the time. I'm like, I miss my explorer, but I'm doing better now, and I'm happy that I've gained like tactile sensitivity. So that's kind of something weird and something that you don't really think about, but you will gain that as time comes along, and I'm sure I will gain more of it too. I'm trying to think, other than it's amazing coming home from work and being like, wow, I'm bored. I think I'm going to have a glass of wine and take a bath and not think about anything until I have to go to work tomorrow. So it truly is worth it, and transitioning is not that bad. It's okay. And if you can get through hygiene school, you can get through your first week in the real world. You can get through anything if you go through hygiene school, I promise. So yeah, it's been awesome and I'm super happy and I love it out in the real world. I love talking to patients. I love just seeing them happy and just being able to help them and know that like I have that confidence to be able to help them now is just truly amazing. So it definitely is worth it, and keep striving, you will get there and it will be okay. if I can do it, seriously, anybody in this world can do it, because you know me. Alright, so I'm pretty sure I have made it through this video, and I'm probably not going to delete it because I really want to get all this information out to you guys as soon as possible. And like I said, I'm going to post another video about how like how to get your first job as a dental hygienist, and things to like remedy situations, and what to look, not what to look for, because I don't want it to seem like I'm pro and conning offices, because that's not what it's doing. It's just kind of talking to you about how to feel comfortable and things like that. So if you guys have any comments or questions or anything like that, if you have even pertaining to hygiene school, I still remember all of it. It was not that long ago. So if you have questions, if you need motivation or anything, just shoot me a message, leave a comment or something, and I got you, because I've been there and I know it's tough and it feels impossible, but it will be okay, I promise. All right, thanks guys.